Hi, my name is Bethany Amy, and this is my IV prep that I am doing for one of my grad classes at Missouri State University. And this is my husband Tim, who will be helping me out. The scenario that I selected was Mary, the 6-year-old patient who was admitted to the hospital for her first time for sepsis. She is needing an IV. Her father is present with her, and she is fearful of new experiences. So Tim will be playing the part of Mary and helping me out with this prep. Hi, Mary. My name's Bethany. How are you?
Nervous.
Okay, that's understandable. So I'm a child life specialist here at the hospital, and my job is meeting all of our patients and families that come in. And I act like a teacher here at the hospital and helping you understand everything that's going on around you. And if I'm not mistaken, this is your first time to the hospital, right?
Mm-hmm.
Wow, this is a pretty big day for you then. It's a lot different than home, isn't it?
Mm-hmm.
Yeah,
Yeah.
absolutely. And it looks like you brought your dad along with you today. Yeah, he's spending some time with you. Did he stay overnight with you last night
Yeah.
too? Okay.
Yeah.
Did you guys watch a movie or read some books together?
Read me book.
Okay, that was pretty fun, I bet.
Mm-hmm.
So your nurse Cindy was telling me, Mary, that you need an IV. Have you had an IV before?
No.
Okay, so this is your first time.
Yeah.
Would it be okay if I tell you about it? And maybe your panda stuffed animal would be able to help us out.
Mm-hmm.
Okay, so we can actually even give Panda an IV too, and I'll talk you through what's going to happen with that, okay?
Okay.
All right. So I just want to let you know really quick that an IV is a special straw that doctors and nurses use, and it goes into one of your veins, and that way they can give you medicine so that the medicine goes throughout your whole body.
Mm-hmm.
So let's start with the veins, though. Do you know what veins are?
Right here, the little line things.
Yeah, and if you flip your hand over too, you have some right here. Those blue lines are filled with something. What do you think's inside of them?
Blood? Water? I don't know.
Yeah, exactly. There's blood in your veins, and that blood goes all over your body. So that way, when your nurse puts the little tiny straw in there, they can get some blood from the straw, but then they can also give you some medicine so that it goes everywhere. Okay? So let's get ready to give Panda an IV. So the first step with getting an IV is the rubber band part that goes on Panda's arm. So let's tie it right there where you're holding onto his arm. Do you want to help me with this part?
Okay.
Good job. Just tie it right there. You have to make it pretty tight. When you make that rubber band tight on his paw, it's going to help all the blood to flow to that veins, and these veins are going to get bigger and puffier so that your nurse Cindy can see it easier.
Mm-hmm.
Okay? So when Cindy finds the best vein that she wants to use, she's going to clean it with a special soap that's cold and wet.
Mm-hmm.
And some patients tell me that this soap has a funny smell, so you're going to have to tell me what you think, okay?
Mm-hmm.
So you can go ahead and clean Panda's paw all over right there and get all those germs off, okay?
Mm-hmm.
Just like that.
Okay. Fun.
Perfect. You cleaned it so well. That was great. So now that Panda's paw is really clean, it's now time to give him the IV. And the way that Nurse Cindy is going to do that is she's going to gently slide the tip of the needle into the vein. Okay, so you might feel a little pinch and a little poke during this part, but the tip of the needle is going to help get it into the right spot in the vein. Okay, so I'm going to do this part, but you can help by holding Panda's paw really still. Okay.
All right.
All right, here we go. So hold it really still. I'm going to slide it in. Should we count?
Yeah.
Okay, help me count. 1, 2, 3. Okay, it's in the right spot. And look, the needle comes out and the needle's in here. So there's nothing sharp or pointy that stays in. It's a plastic bendy straw. I'm going to show you really quick what it looks like. This is the plastic bendy straw, and you can feel that. What does it feel like?
So bendy.
Yeah. So now that the straw is in the right place, we're going to put some tape on there so that it stays there and it doesn't move. So I'll keep holding onto his paw, and I will let you put the tape on. Okay? There you go. I'll hold it, and you can put the tape on. I'll help guide it just like that. You put it on in the perfect spot. That was great. And push it on. Make sure it's on there pretty well. And then you can peel this part off. Okay? There we go. And now that we have the tape on there and the straw's in the right spot, we need to collect some blood from the tube. So we do that by using some syringes that look like this. So I'm now going to hold on to his paw and I'm going to let you play with the syringe and see what it feels like. So,
slidey.
Exactly. So we can slide or we can screw this on to the end of the tube here. And when it's on there, then we would pull back and we'd be able to get some blood that fills up the tube syringe. Okay. Once we get all of the blood that we need, the nurses will fill these tubes, which are called blood tubes, and they will send those to a place called the lab where they'll be able to look at what's inside of your blood. So once we get all the blood that we need, it's then time to give him a drink through his tube. So this is what Nurse Cindy would call giving it a flush with saline. So that means giving it a drink with this special water. And sometimes patients tell me that it gives them a salty taste in their mouth. So you're going to have to let me know if you taste anything, okay? So if you look, here we're going to put a bubble at the top. And look, it's almost like a squirt gun. Just like that. So then we would be able to screw this onto the end of the IV and we'd be able to push it right in. So I'm going to hold it and I'll let you push the water in. Good job. Yeah, that was great. Just like that, you pushed it in perfectly. So now that the IV is in the perfect spot and it's had the water that it needs, that means the IV is working and it's good to go. Okay. Are there any questions that you have right now about your IV?
Is it going to hurt me?
That's a really good question. You might feel a pinch and a poke when they're gently sliding the tip of the needle in, okay? But you're going to have to tell us what you feel when it's all done, okay?
Okay.
And also, because Dad's here, you get to decide if you want to sit on Dad's lap for the IV, if you want Dad to sit next to you in bed or stand next to you. And also, do you want to watch what the nurse is doing near the IV, or would you rather work on something else like blowing bubbles or looking at an I Spy book?
Good. Yeah, I Spy. I like that.
All right. Sounds good, Mary. You did an awesome job giving Panda that IV.